You mentioned that the project also focuses on artificial intelligence, machine learning, and the National Data Warehouse. How are these innovations currently improving health outcomes, particularly for people living with HIV?
Yes, so you see, we are living in the era of AI. We are coming from the era, in fact, we are closing the era of data and even big data. Now the question is, how do you optimize this data? Using AI-driven solutions to drive efficiency, to drive interventions, to drive decision-making, but also to drive strategy moving forward. And so AI is now the way forward, if I may say. That's the direction when we talk about especially health informatics, because we are introducing AI-driven health informatics solution. Like you correctly indicated, we have developed and are validating and also deployed one of the machine learning models on viral load failure. We have a model in the pipeline on mortality rate. We also have a model on COVID that we have developed. These are just predictive models. We have now even introduced large language models, partnering with organizations that are specialized in these things like Label Fuse. We develop and are validating a large language model that will ensure efficiency in terms of monitoring of clinical practice, monitoring of programs. You know, like we are coming from a period where we used to have M&E at the core of monitoring programs. But we are saying, how can we optimize AI to have a quick turnaround time in terms of decision making? We have use cases that are in the making in terms of supporting, or rather using them as clinical decision support systems for clinicians themselves. Where, for instance, we know that in terms of public health, non-communicable diseases are really emerging, right? How do we support clinicians, to treat and manage those NCDs? We are introducing a typical clinical assistant AI solution to support decision for clinicians. We are introducing a programmatic and even M&E, we call it M&E 0.2, 2.0, meaning version 2, to drive AI-driven solution or AI-driven M&E, where you don't even need to wait for the so-called M&E specialist to make decision, but you can hit the model and it can tell you what you should do moving forward. So this is where we are, and this is the future for us.
That's quite interesting. Could you share an example of how better use of data has directly influenced decision-making or improved service delivery on the ground?
For us, we are innovative. As an IHM team, we didn't only want to develop systems that will drive only external operations or ops, or even just healthcare services and public programming. But also we thought, even internally, inward facing, how can we use data, innovate and use data to drive operations. I was telling you earlier in terms of the successes for the project. We managed to scale up the system within 2 years into 1,615 facilities, coming from legacy systems that were introduced in 2003. But us, we managed to deliver that in 2 years. Why? Because we use data-driven innovation. A case in point, we use geospatial intelligence to map out where we are going in terms of scaling up the system, to map out the route to ensure optimal allocation of resources and access to these facilities. And that's why we could activate facilities, 400 facilities, within record time, 2 weeks. That has never been seen before. But we managed to do it. That is the application of data to inform decision. We indicated earlier to say we have dashboards at executive level and at an operational level that are being used to inform decision. Decision in programming, public health programming, decision in executive decision to say, are we still in line in terms of public health strategy in the country? For instance, the problem with most of our African countries is maternal and child mortality. Are we making an impact as a country? Like I told you, we have a dashboard that is addressing that, right? So these are examples on how we've been using data to inform decision. These also are driving, in a way, policy. For instance, in the country, the clinical guidelines evolve because as a country we sit together to review data and deduce and evolve on how we move forward vis-a-vis standards set by WHO internationally.
So on the sustainability side, how far along are we in transferring HIS skills to local institutions and the Ministry of Health?
That one, really, it's a strategy that the project is really trying to advance. I think at this point, being a project that is in 4th year, this is becoming more relevant because before you know, we'll be closing the COAC. So for instance, what we have done so far is to say, having developed even the sustainability plan, developed the transitioning plan, but start institutionalizing the procedures I spoke about. You might have heard from our government capacity building lead indicating that he is reviewing and validating these SOPs and documents to be transferred to the ministry. The idea is to make sure that they're anchored or institutionalized within the ministry so that even the ministry moving forward, they understand how these systems are supposed to be managed and implemented. So we are at that stage. The next stage, obviously, we have also started developing data governance framework. How is this data going to be governed in the context of the Data Commission in Zambia? Are we aligned? What are the cybersecurity frameworks that we are transitioning to the ministry to ensure that data is secured and is protected as the Protection Act of 2021, the Zambian Act? Those are the government's processes that we are currently doing, but also have worked with relevant constituencies to introduce a health informatics curriculum and are, piloting that curriculum to ensure scale up. This is driving issues of pre-service training to make sure that as the healthcare providers are transitioning from their tertiary education to start practice, they have an understanding to say what are the systems that we'll be dealing with in the workspace. So those are the things that we have done, especially to reinforce sustainability. There is also arrangements where we are engaging universities, engaging institutions, engaging digital hubs within Zambia to make sure that there is that capacity, How can we work together to create a pool, for instance, of software developers that can manage and sustain the system moving forward when IHM is gone? Working towards ensuring that the system is sustainable within the ministry, normative environment, because that normative environment really is very critical for us to appreciate.